Hi, I'm Dr. Hizon, here to talk about medical informatics for the shoulder impingement syndrome patient. Again, as we always talk about, please refer to your particular doctor for the details of the examination and the documentation. This is a general course, not intended to be medical treatment, and your particular situation may vary. So the symptoms that most occur in shoulder impingement are usually non-traumatic shoulder pain. The pain is with overhead activities, reaching backwards, and at night when trying to sleep. And the patient may complain that they hear popping and grinding sounds. On the physical examination, there's usually tenderness with forward flexion. They may have a positive NIRS sign. There's a lot of these orthopedic signs that are shortcuts for what the test is. And again, as you're a novice in the documentation, you're going to need to learn the NIRS test, the Hawkins-Kennedy test, O'Brien's test, drop arm test, crossover test, scarf test, and the Jobs test. A lot of times we'll, besides the history and physical, do some imaging such as x-rays, muscular skeletal ultrasound, and even an MRI. The treatment is usually to avoid aggravating activities, usually a course of anti-inflammatory medications such as naproxen or ibuprofen, home exercises, or even formal physical therapy, and they may want to use ice at night for say 15 minutes several times a day. And if the simple things don't work, then many times they have to end up doing injections either of cortisone or other biologicals, and the most common one these days is platelet-rich plasma or PRP. And then if all else fails, then there is surgeries. And there's two kinds. There's an arthroscopic type, which is a subacromial decompression. You can also fix the rotator cuff. Sometimes you have to repair the labrum, which is the lip around the shoulder, as well as even excision of the distal clavicle. But sometimes you're not able to do it arthroscopically, and you may need to do an open procedure. On patient education, we remind them not to do things that irritate it, such as aggravating activities. And in weightlifting, the most common things that aggravate shoulder impingement is overhead presses, something called flat bench presses, pec flies, and lat pull-downs. So on the actual documentation, the most important thing on the chief complaint is which shoulder, and it's very important to get the correct shoulder pain, and then also how long is the symptoms been there in duration, either in days or weeks or months or even years. For the history of the present illness, this is a typical one that you might use. The patient is a so many years old male or female with a history of previous things such as diabetes or heart disease or whatever, and then has pain today for the what shoulder, left or right, be sure to get that correct, and the duration. And then you can go through this template to say what is the mechanism of injury, how long have they had it, where is the pain, front or back, and then severity is very important. The level of pain out of 10, both at rest and with activities, the duration, quality, and then what makes it worse, and frankly, what makes it better. Then you can look at other symptoms that it goes through, and you can go through the template. Especially, I like to know what previous treatments have they had so far before they get to me. Have they been in a sling, an injection, medications, or physical therapy? What previous workups or imaging have they done? And have they seen any other providers? And then in the past medical, family, social history review of systems, these are very helpful to be sure that you have a complete examination of this patient. On the objective or the physical findings, you're going to look at the joint above and below in orthopedics. So the cervical spine is above the shoulder, then the elbows are below, and then you want to make sure you know which is the unaffected shoulder and which is the affected shoulder. And a typical physical exam, and again, this is just an example, might be that the patient on the affected shoulder has limited range of motion, a positive Hawkins sign, positive NIRS test, O'Brien's test, scarf sign, and they have a negative apprehension test, negative drop arm test, positive crepitation with ranging, tenderness in the anterior aspect, or they could have it in the posterior, they could have it over the distal clavicle, but neurovascularly they are intact. And in the medical decision making, the provider will most likely want to know if it's a simple or complicated case, is it straightforward or complex decision making, and then will give reasons for why they're treating it a certain way. These are typical diagnostic codes. A lot of times it's good to put that pain as the first one, and then after that the specific diagnosis. Understand with orthopedic type injuries, it's very important to also put in 2 other codes, the activity they're doing, as well as where did that activity occur. And got to give a little shout out to my brother Vince, who was a basketball player. And then plan is, are they going to do home exercises, formal therapy, anti-inflammatory medications, and make sure you get the dosage right? Are they going to do x-rays of the shoulder? Are they going to use muscular skeletal ultrasound of the shoulder, MRI imaging? Or are they going to do an injection or even surgery? So in the pearls of documenting for a shoulder impingement patient, be sure to get the correct affected side, left versus right. I know this sounds simple, but wrong side surgery does happen, so you have to be very, very careful to get the correct surgery. You cannot be too careful on this. Be sure to document all previous treatments. What have they done in terms of have they had shoulder surgeries? Have they had shoulder dislocation? And then for you as a medical informatics specialist, learn the various tests such as Neer's, Hawkins, O'Brien's, Job's, and the drop arm test. And then please ask your doctor or provider if you have questions about the examination of the shoulder. I really like it when my medical informatics specialist is participatory to make sure we get the documentation correct. And then also, if you're working in primary care like I'm in, you have to look at quality measures. Even if they come in for the shoulder, have they had their healthcare maintenance type things such as their mammograms or pap smears or other types of screening tests. And takeaway points is that impingement syndrome of the shoulder is very common. It usually occurs in a non-traumatic way, meaning there is no usual specific event. I like to say a history of impingement is that there is no history. And then study hard to learn the various shoulder tests that are common to use as shortcuts in orthopedics and primary care, such as the Neer's, Hawkins, and O'Brien tests. And again, I want to emphasize that while doctors save lives, you medical informatics specialists save doctors. Thank you.